Hello, I'm Stephanie.
I'm Jessica.
I'm Holly.
And I'm Brianna. We are fourth year nursing students at Western University, and we are going to be discussing the wicked problem of childhood obesity within the Aboriginal population in Canada.
Childhood obesity is a significant wicked problem within the Aboriginal population which needs to be resolved.
The World Health Organization describes obesity as a result of a large disparity between the intake and output of calories for an individual.
Across North America, the percentage of obesity within the Aboriginal population is double that of the non-Aboriginal population.
Moreover, the vast majority of individuals within these high rates of obesity are the Aboriginal children.
It needs to be recognized that the reduction of childhood obesity is a complex process, as it goes beyond simply telling people to eat less and exercise more. This process resembles a large interrelated web between the individual and social determinants of health. For example, if a child is born into a low-income family, that child may experience difficulty accessing nutritious foods and resources to support a healthy lifestyle.
One negative social determinant of health can create a ripple effect outward, impacting other aspects of an individual's health and well-being. Childhood obesity requires multi-level action and a transdisciplinary approach.
Everyone knows what is required to end childhood obesity. However, social determinants of health act as a barrier to overcome this wicked problem.
Policy change regarding the decrease of childhood obesity at the individual, population, and government levels strive to alter inequalities in the social determinants of health, thereby increasing the overall quality of life experienced by Aboriginal populations. From our research, we came up with 3 options to address this wicked problem.
The first option that we are discussing is childhood obesity on an individual level. Current evidence has found that children tend to rely on adult family members, in particular mothers, more than teachers as their primary source of information. Therefore, the first option targets expectant mothers, involving the role of healthcare professionals in providing information regarding healthy nutritional practices influencing healthy child's development. This is an upstream approach because it enables prevention of childhood obesity before it begins. If you are able to instill these values in children during early life, they will continue to foster and live by them as they grow older.
For our second option, we are going to be discussing policy change at a population level. The Aboriginal population in Canada are experiencing high levels of food insecurity. Food insecurity can be defined as insufficient and unstable availability or access to food and the inability to utilize food appropriately. When considering policy change at a population level, it would only seem fit to consider where the vast majority of Aboriginal people are residing within Canada. It is recommended that community kitchens and gardens are tailored towards fitting the cultural needs of Aboriginal communities in urban settings. By placing community kitchens and gardens in more accessible locations, the community is provided with a sustainable option that will not only increase the amount of nutritious food available, but will also provide the community with autonomy and independence to harvest their own resources.
For our third option, we are going to be discussing policy change at the government level. The Truth and Reconciliation Commission of Canada developed recommendations that can be used to reduce the inequities experienced by the Aboriginal population. In particular, we believe that Recommendation 19 should be made into a policy. Recommendation 19 states that the federal government should establish measurable goals to identify and close the gaps in health outcomes between Aboriginal and non-Aboriginal communities, and publish annual progress reports and assess long-term trends. By recognizing these inequities, we are one step closer to tackling this wicked problem.
Ultimately, we think that option 2 will be the most effective and viable recommendation. Programs that are the most sustainable involve linking together community kitchens and community gardens. These community resources will empower Aboriginal populations to take ownership of their health outcomes and move away from dependence on government resources. Not only does this recommendation increase the accessibility and quantity of nutritious food, but it also provides more independence related to the population's harvesting abilities of foods valued within their culture. If children are involved in the growth and harvest of nutritious food, they will be more motivated to continue these practices throughout their life and lead a healthy lifestyle.
It is through involving the Aboriginal community, embracing their strengths and actively listening to their opinions, that the wicked problem of childhood obesity can be tackled and positive change can ensue.